In this morning's Health Watch, Ask It Early, we are tackling questions from sugar substitutes to migraine treatment options.
And here with the answers is medical contributor Dr. Holly Phillips. Great to have you with us, Holly. Good morning.
Great to be here as always.
And our first question comes from Facebook. Lakeisha asks, what is the difference between natural sugar and a sugar substitute for diabetics?
Actually, this is a very important question. I'm asked this often by my diabetic patients and also my patients who are at risk for diabetes. So in general, the sugar substitutes are a good idea for diabetics. They have fewer calories, but even more important than that, they have fewer carbs, which we know really drive up blood sugar. So if you look at regular sugar here, it would be about 11 calories and 3 to 4 grams of carbs. Now, each of the sugar substitutes is a little different, but in general, you're looking more at 3 to 4 calories and less than 1 gram of carbs. Also keep in mind, though, the sugar substitutes are incredibly sweet, about 100 times as sweet as sugar, so a little bit goes a long way.
And this actually leads us perfectly into our next question, because a lot of people are worried about, with all the sweets, gaining weight this holiday season, so they may relate to this question from Monica.
I have a trouble of overeating, so how do you not do that?
How do you not do that, Holly?
Yeah, you know what? I think that's a work in progress for all of us during the holiday season. But really, diet experts say there are some basic tips to follow. First is to eat slowly. It actually takes our body between 12 and 20 minutes to register that it's starting to feel full. So if you eat slowly, you won't have stuffed in too much by the time you realize you're actually satiated. Also, pay attention when you're eating. Try to avoid the unconscious eating, like in front of the TV set, of course my favorite, or driving, but then you end up eating more than if you're really paying attention and having a meal. Also try to choose satisfying and filling foods. We all know the things that are high in calories but don't really fill you up, like chocolate, cheese, milkshakes. If you
You're
can,
making me hungry,
I know. But really, reach for the protein and high fiber foods, just so you at least get filled up after your calories. And finally, use a smaller plate. It seems obvious, but there is actual research out there that we take smaller portions and we eat less when we use a smaller plate. So for the rest of the holidays, I'm just going to, maybe use a teacup size plate, and hope for the best.
That is a great plan. Next question, another one from Facebook. Michael asks, what's a good way to take away a migraine if you don't have access to aspirin?
Well, really, with both migraine and tension headache, the key is to stop what you're doing. If you can get into a cool, dark room, that will help. Make sure to hydrate. Plenty of water also helps. If you can do a cool cloth on your forehead or behind the neck, you might get a little bit of relief. But again, with all headaches, the key is prevention. So really try to identify your triggers, whether they're bright lights, specific foods, missing meals, being too tired, whatever it is that's triggering the headache. By combating that, you're more likely to get some relief.
Great advice, Dr. Holly Phillips. Thank you. We really appreciate it.
Always great to be here.